Hey everybody, Bob Finelli, welcome back. And today on Movement Science, we're going to talk about your joints a little bit, okay? And that they're an integrated set of structures, not a separated one or an isolated one. Okay, so we'll head back over to the chair, to our favorite spot to talk about the knee to start to show that things are integrated, not isolated. And why is that important to us? Why does the body do that? And what is it doing and how does that help us? If I'm sitting here and I just extend my leg forward, that joint shows very little integration with, say, my hip or my foot or my trunk or anything else, right? However, remember, when I hit the ground and I'm in my sport or I'm moving around in the gym, boom, you can see as soon as my foot hits the ground, something happens at my ankle, then happens at my knee, then happens at my hip, which is then going to drive my trunk. Why? Because all joints are integrated. So motion at a particular joint, assuming you're upright on the ground, moving, not just standing still, will influence the whole system. But what that also means is that if we have restriction at a joint, that's going to influence the whole system. And here's something really interesting to know. One reason that all your joints, again, and we talked about this, are triaxial, they can move front to back, side to side, and twist, is because your muscles are also aligned in different positions. Some rotate, some go sideways, some go straight up and down. So depending upon where that muscle attaches, I'm going to want the bones or the joints to move, to lengthen, shorten, twist, move laterally that muscle. What a brilliant design the body is. It says, no problem, I can get that muscle, I'm going to allow these joints to move, because again, if joints are where motion occurs through bones, if I drive motion directly through a bone, it's going to snap. Okay, so we have a joint surface. Now, when I go around, for example, and rotate, my body's going to want all of these joints to follow around in rotation. My top bone and my bottom bone make up the knee, okay, as well as my foot and my hip, okay? So this top bone's driven by my hip, the bottom bone's driven by my foot. When I go around, I want everybody to rotate with me. But what if I had a really tight ankle and it didn't rotate well, and just my top bone went around, but my bottom bone didn't? My knee's going to feel that. And after time, it's going to start to wear away and have tissue changes. The body says, well, the problem is all the joints are integrated. Yours have now become somewhat isolated due to restriction in motion. Joints will say, I need that motion back. Because with that motion, I can follow where you're asking me to go. I can also get the big muscles to take all that load. I don't mind if it comes in the joint, but I want it to pass through it. I don't want it localized in the joint, okay? So all joints are integrated. And again, that's why when you see people hit the ground, you might see a knee go in. Or if my hands are here, you're gonna see a knee go out. That's the integration of the joints. That's also the chain reaction of the body, right? So remember, joints are triaxial and integrated. Treat the body as such.